housing front and the social services side, all of that great talent came to us with a very strong communication skill that I think has led us through the pandemic and all these other issues extremely well. So I just want to thank Paul for his incredible work here at the City of Hamilton and wish him all the very best in Toronto. And I know that our paths are going to cross many, many more times, personally and publicly, and I look forward to that into the future. Moving into today's briefing, though, I'd like to thank everyone that has received their first dose or has completed their vaccine series. Thank you very much. That's very, very important to do. We want to have the highest level of protection possible for our community. That really means more and more people getting vaccinated each and every day, and certainly we encourage that to happen. We have 80% of our residents age 12 and older that must have their first dose of the vaccine, with 75% of the residents having their second dose of the vaccine by September the 3rd, so that we can move into the next phase of our open. And hopefully we can do that without increasing the case counts in the City of Hamilton, and certainly that will be assisted by more and more people getting the vaccine. I know the doctor will talk about locations for where we can get vaccines right now, but right now you can walk in or schedule an appointment at your convenience at any of the Hamilton clinics that are open right now. Neighborhood mobile pop-up clinics are available. Primary care-led clinics are also available. Plus, 100 pharmacies are offering COVID-19 vaccines in Hamilton. So all of those is available to you right now, and there's more mobile pop-up clinics coming into the future that will allow for additional vaccination opportunities. And there's no shortage of supply. So, you know, in previous days or previous months, supply was the limiting issue in terms of being able to vaccinate individuals in our community. That is no longer the case. In fact, Canada leads the way in terms of supply of vaccine available and vaccinations in the community. And we certainly would like to see that continue. As well, the first week of school is under a month away. And as we fall into the fall and spend more time indoors, it's important for our community members, especially young people 12 to 18 years of age, to protect themselves and book a first and second dose of COVID-19 as soon as possible. So for more information on all of that, please visit hamilton.ca/vaccine booking to book your vaccine appointment, or drop into our existing vaccination clinics. They'll be happy to see you and happy to give you a vaccination as well. And on that note, since we're going to change the order a little bit today, we're going to give our Medical Officer of Health an opportunity to share her thoughts, and we'll give Paul Johnson an opportunity to share his thoughts at the end of the media briefing. So, Dr. Elizabeth, it's all yours.
Thanks very much, Mr. Mayor. Yes, I'm going to start us off with our case numbers today for this week. Unfortunately, we're in the situation where our case numbers are increasing. We're at 21,840 cases total, net change of 89 cases over the course of the weekend. So that, of course, is from Friday, August the 6th. And with these increases, our local activity now mirrors that seen in early to mid-October of 2020. And the cases are rising, particularly in the 0 to 59-year age group. And so that is a concern as well, because we know that our vaccination rates aren't as high in those lower age groups. And of course, those under the age of 12 not being able to be vaccinated at all. The average number of new hospitalizations and the average number of deaths occurring per day does remain low, but of course, these are things that lag behind in terms of the cases. We do very much find that the vaccines make a significant difference when it comes to disease severity, and so anybody who has the vaccine has a lower risk of being hospitalized or other severe outcomes from COVID-19. So that is part of why it's very important, or the genesis of why it's very important. Our 7-day moving average today is at 22, weekly incidence per 100,000 population at 25, and our weekly reproductive number at 0.97. We have 7 active outbreaks that are going on with no new outbreaks to report today. Our percent positivity amongst the test results as well is showing early signs of an increase, currently sitting at 2.4%. So as I said, those indicators of an early rise in the COVID activity in Hamilton. From a vaccine perspective, as you heard from the mayor, we're sitting today with an estimated 77.2% of Hamiltonians 12 years of age and over having had their first dose to date, and 67.8% 12 and over are now fully vaccinated. So that means there's 364,436 people in Hamilton who are fully vaccinated. Tremendous progress, 746,000 doses overall that have been given out. And of course, as you heard from the mayors, we're progressing towards the end of summer, unfortunately, but that means a return to school for students, for educators, for all those who work in school settings, in universities, colleges, but also for all of us, a return to inside. We definitely have a clock ticking here with our vaccine coverage and wanting people to get vaccinated with both first and second doses as soon as possible. We're also, of course, concerned that our vaccine coverage isn't equal in our community. We know that according to age, there's a difference in terms of vaccine coverage, with those who are younger, youth and young adults having a lower vaccine coverage than those who are older. Certainly that's a function of time and the fact that for those older age groups, they have had more opportunities to get vaccinated. But we also know that there are some differences by a geographic area within the city as well. And so part of what you'll see with the work that we are doing is looking at where in the city can we target those clinics, can we target even more closely as we go forward. And you'll see more about that at the Board of Health meeting on Wednesday. It's the vaccine, when you look at the data that comes out of Public Health Ontario, it certainly bears out this whole piece about the protection from the vaccine. As of July 24th, which is the last update we had from Public Health Ontario, out of the 17,210 COVID-19 cases that have been reported in Hamilton since December of last year, which is when the vaccine first became available, only 0.5% have been fully vaccinated individuals, 4.4% in partially vaccinated individuals, meaning that over 95% of COVID-19 cases have been in those that are not vaccinated. As I said earlier, very important to remember too that the likelihood of becoming seriously ill or dying is significantly higher in those who have not been vaccinated compared with those that are fully vaccinated. And when we're talking about this Delta variant, it is that full 2 doses that is most important to get good protection. So you'll see, along with all of our healthcare partners here in Hamilton, there's a continued push to increase vaccination rates across all parts of our community. One critical part of that is to accelerate second doses for those who have already had their first dose. And so anyone who is 28 days past their first dose of COVID-19 vaccine is asked to please come on out for a second dose as soon as possible. You can do that by booking an appointment if that's the most convenient way for you, or just walking into any one of our large-scale clinics, any one of our mobile clinics, and several of our pharmacies and others, along with the David Braley Health Science Center, offer walk-in vaccinations as well. For those of you who may have gotten a text message or an email from ourselves, from Public Health Services in Hamilton, or from one of our Hamilton healthcare partners like St. Joseph's Hospital Hamilton, who've been helping out with these calls, please do pay attention to those texts, those emails. We're trying to get out to about 22,000 people who still have second doses in the system. We are in the process of turning those over to the Ministry of Health. And once the Ministry of Health has tried to reach out to all of those who still have a second dose booked after August the 29th, those appointments will be canceled, particularly because our large-scale clinics are closing down through a very careful and measured approach. And so they will be canceled, and then people will, of course, have been left either through those texts, emails, or otherwise a way to call and book an appointment, or of course, just walk into one of our clinics. There is abundant supply of vaccine. There is choice in terms of which vaccine people may want to receive. We have both Pfizer and Moderna vaccines, so people are able at most of our sites to get either of those vaccines as they choose. And of course, as the mayor has said, we have our large scale clinics, we have our mobile clinics that are out in the community. The ministry has been helping us with clinics, bringing out their resources. We may well get their new bus that they've implemented as well to come out and help us with them. And of course, there are the 2 primary care-led clinics that continue on in our community. So while we're going through this stage, of course, following public health measures remains really important in this stage. Mask wearing, keeping distance if you can't wear a mask, and continue to wash your hands, stay home if you're sick, are all very, very important. And as we move forward with all of these vaccination efforts, it's so essential so we can protect the ones we love and, of course, get back to doing what we love. So all the available vaccine clinics, the operating hours are at hamilton.ca/getyourvaccine. It's updated regularly with the most up-to-date information, or you can call through to the province's system as well at 1-888-999-6488 to book a vaccine appointment if you would like to. With that, I'm just going to take my last couple of moments to thank Paul. So as Mayor Eisenberger has mentioned, there are plenty of mixed emotions this afternoon, with this being Paul's final briefing. And I cannot put into words just how grateful I am for Paul's leadership and commitment throughout this challenging time for the city of Hamilton and all Hamiltonians and visitors to our city. But I'm going to take a couple more moments to try and express that. Paul has led by example since day one. When he first started with the city, with each role that he has taken on, whether that was, as you heard from the mayor, with the transit approach, whether it was with taking over as general manager of Healthy and Safe Communities, and of course, when he took over with the Emergency Operations Center in March of 2020 and took the reins as the Eoc Director. You knew each and every time that Paul made an important decision through this and about our pandemic response, that he did so with the community's health and safety as his number one priority. His character is the epitome of the phrase, when the going gets tough, the tough get going. His toughness and perseverance have been unparalleled and have always been done with such tremendous compassion and grace. On behalf of the entire team at Hamilton Public Health Services, I want to extend our gratitude and thanks for the dedication you have shown, Paul, to your work, to all of your teams and all of their members, and to the City of Hamilton. Thank you, Paul. The City of Toronto is going to be very well served. Over to you.
Well, thank you so much, Elizabeth and Mr. Mayor, for your kind words. Yeah, this was, I was saying before we came on air, this has been the day where things kind of hit you. It's as of the end of today, I will turn the reins of the EOC over to our new EOC Director. It'll be Jason Thorne moving forward as a permanent director, and we've got some people helping out while he's on a bit of a vacation as well. And of course, work continues at the department level, and we have a general manager, Grace Mader, who's taking on that work. So it is one of those days where it just hits you. And I will miss working alongside these two folks, however they're displayed on your screen. They're either side of me on my screen today. And it's just been wonderful to work alongside these two folks so many times. I think we're at 103 of these, and all the other ways that we've been communicating with media and the public throughout this. And I couldn't have worked with two better leaders alongside the work that I was doing at the EOC. You know, the thing that can undermine particularly a long emergency like this is if the political side of the House has trouble connecting and keeping in touch and being supportive of the staff side of the House. That has never happened during this pandemic. The mayor and I have spoken so often. I think his number is the number one number I call on my cell phone now. And throughout it, we have shared ideas. I've taken on his wisdom and thoughts in terms of what he's hearing in the community, and that's help us make better decisions. And likewise, he has listened to the expertise that's around the EOC table and has always been supportive of our efforts. And then in this emergency, which is not unique. We've had public health emergencies before, but certainly unique in terms of its duration and impact. You have to have a solid public health team there. The EOC does not run the public health response. That's the work of public health. But the two are connected through almost every decision, because logistically and support-wise and communication-wise, we have to be on the same page. And so it can't be a world of what's happening in public health that we believe or that we think about at the EOC. We have to know what's going on, and vice versa. Dr. Richardson needs to understand what's happening through the rest of the community and through the city as a whole, and we've done that. So thanks to the two folks that I've partnered with in person and much of the time virtually on these events. It's been an absolute pleasure. I will chime in with just a couple of things in my last day as the EOC Director to say that We remain in step 3 of the reopening. And I know that some people have found and are looking at the fact that the province has released the regulations for what they're calling their exit step, or the step beyond step 3, step 4, if you want to call it that. But it's important to recognize that that date for that exit step has not been set. So all of the restrictions are still the step 3 restrictions, which do restrict the number overall of people that can attend in certain facilities, and the percentages of people that can be involved in certain facilities and businesses. And certainly as we look at events happening in the community, there are restrictions on the numbers that happen there. If you have looked at what's coming, it's pretty clear in this province that what's coming is obviously a removal of restrictions in terms of volumes of people that can be in spaces. Some of the public health measures will be pulled back a bit, but not others. We are going to be, as you've heard Dr. Richardson say, and you've heard the Premier say, and Dr. Moore say, that we're going to be wearing masks indoors for some time. And so masking in public spaces is here to stay as a good part of a large volume of public health measures, as Dr. Richardson shares with us each and every time. So we are looking forward to the time where the restrictions, and for certain businesses, we know that these restrictions today, it's certainly better to be open than closed, but open with restrictions can sometimes mean that business is right on that knife edge. And we know that businesses and organizations and community activities and events are looking forward to not having those restrictions in place. When that will happen, we don't know. That's the province's decision to make. It's tied not only to vaccination rates, but looking at other issues such as the cases that you've heard Dr. Richardson talk about today, and other measures at the local level that really will indicate when the time is right for us to move into that exit step and start to really build an approach that can be sustained through the coming months. What no one wants to do is take steps backwards into more restrictive phases, so it's best to do it at the right time. So I encourage the community to continue to do what's right. There's been a huge push, I will say, from some folks that are on this call and others in the community for me to say knock it off today for some reason in particular. But you know what? We're doing so well. We're out enjoying what we should be enjoying. You will note that we've had very few businesses that have been placed onto the list of businesses where we've had to lay a charge. We do have one that's there. Again, people are taking note when employees and people in establishments are not wearing masks as they should. Obviously, that's generating complaints, and we have one of those there. But by and large, given the volume of activity that's happening in our community now that we've moved into step 3, we're not seeing those charges laid. The charges we are laying are about the normal things that would happen in summer, in particular around our waterfalls. So people are figuring out ways to get out and do the things they want to do and do them safely. We've had, events at Tim Hortons Field with our Forge football team, the football that you kick with your foot around, and we're heading forward, of course, to Labor Day, where we'll have the other football team on the field as well. And all of those things are good. They're being done well. And I think today it's going to be more of keep it up instead of knock it off, because I'd like my parting words from an EOC perspective to be, keep up the work. Every time we take a step forward, do everything that we can do in that step and embrace that, but don't go looking for the things we can't do yet. And if we need to keep those masks on in indoor spaces for a little while longer, let's do it. It's not that big a deal. If we need to always be washing our hands and using sanitizer, that's going to help us when it comes to flu and colds and all sorts of other things when we finally knock this COVID-19 on its rear end. So all of those things are what will help us continue to make strides in this community. And for my final words in terms of the EOC director and being on these calls, I do want to thank a couple of groups. You've heard me talk about my colleagues that have been on these calls. I want to extend that to all of council, who has been extremely supportive of the work that Dr. Richardson and I do, and our colleagues at our respective emergency tables. I want to thank my colleagues at the City of Hamilton, all 8,000 of them. People have heard me say this before, an EOC director, an EOC management team, which is 19 individuals at the City of Hamilton. We are only as good as the people who then go out and execute and implement the things that need to be done to keep this community safe. It makes no difference what Paul Johnson says on a daily basis. It makes a huge difference what our team goes out and does on a daily basis to keep us safe. And then I want to extend that into the community. all of the businesses and the organizations that have stepped up, the way that you have either persevered through this horrible crisis and continue to persevere through the tail end of this crisis, to those who stepped up and did other things, whether it was make PPE, whether it was offer food to first responders or offer food to charitable organizations, whatever it is you were doing, it helped us get through some of those darker days. And I know in our vaccine strategy, many people have stepped to the table in order to make that happen. We simply could not have done it with just the resources that exist within hospitals and within our public health unit. To our media partners who are on this call today, and many of who have cycled through these briefings over the last 17 months or so, thank you for your work. Communication is critical, and your ability to ask the questions, but also disseminate the information has been absolutely necessary. There were days where I know the list of stuff that we were communicating was long and not complicated in terms of each individual piece, but complicated in terms of the whole package. What could we do? What couldn't we do? What was open and what was closed? And you've done an absolutely fantastic job of keeping this community informed as best we can with something that's as long lasting as this. Bill Custers and the team here at Cable 14, Clear Cable that helps out, and all the other media partners that have simulcast these over the years, over the time. Thank you so much for that. So stay safe, everybody. Keep up the great work. There's a team here that is going to maintain every level of vigilance that's necessary and deal with every crisis and flare up that happens along the way. And I look forward to being in this community, continuing to enjoy more and more events myself, and look forward to the work that will continue to happen here at the City of Hamilton as I go and start new work and exciting work with the City of Toronto. Thanks very much. And with that, back to you, Mr. Mayor.
Thank you very much, Paul and Elizabeth. And as well noted, Paul, humble as always, sharing the benefit of your work and everyone else's work with a lot of other great people in our community that have been doing great things. So thank you for that. The only people you didn't thank was Mom and Dad. And I know they're immensely proud of their boy, Paul, not only for what he's done in Hamilton, but what he's going to do for Toronto in the future. So all the very best to you. And for our audience at large, we do need to remember to protect ourselves to beat this virus. And as Paul pointed out, mask wearing is probably going to be with us for quite some time, given the status of the Delta variant and the concern about a fourth wave. Hopefully not, but certainly we have to be cognizant of that. And so continuing to protect yourself and others from this virus is going to be critically important, as well as continuing to get that vaccine. And there are going to be more and more ways to get the vaccine today than there ever have been. And we certainly hope that you're listening to the right people in terms of getting appropriate information on why it's important to do and the benefits to you as you continue to want to participate in the opening up of our community and our society and all the great things that are happening in our community. And so the ambassadors are out there working. I understand we're working at 541 Barton, answering questions around the vaccine in that location and a number of other locations downtown to help get people informed and encourage them to make an informed decision on whether or not that vaccine is right for them. And I would argue that vaccine is not new. Vaccines have been with us since we were children, and we all have a passport of some sort identifying the vaccines that we've received to date. This is another important vaccine that I think you need to turn your mind to for those that have not yet been vaccinated or haven't completed their vaccine series. On that hopeful note, let me turn it over to Jasmine for some questions from the media. Jasmine.
Great, thank you, Mr. Mayor. We have 3 media joining us for the briefing today. We'll start with one question and one follow-up for everybody. Our first question goes to Emily Taylor from CHCH News. Emily, you can go ahead.
Hi, everyone, and happy last day to Paul Johnson. If I can just clarify something that was said at the beginning of this briefing, I believe Mayor Eisenberger had referenced as September 3rd as sort of the new date to look forward to for maybe leaving the stage 3 and to have those vaccine levels up. But then later, Paul Johnson sort of mentioned that there was no set date in place for exiting step 3. Can you just clarify if there is sort of a self-imposed deadline for getting these vaccine rates up, or what that September 3rd date indicates?
Okay.
So the province is not just yet indicated when they will take the province into the exit step. So we're still awaiting that. The earliest it could have happened was Friday. That was 21 days after we moved into step 3.
For sure. Okay, sorry. I thought there was a mention of September 3rd at the beginning of the meeting, so I was wondering what date that was. Anyways, okay, perhaps I misheard. Then turning to Dr. Richardson.
Let me clarify. I think that was
yeah.
I misspoke on that one. I think I read September 3, and it was actually step 3 that we would come out of if we got to 80% residents 12 and older vaccinated first dose and 75% vaccinated second dose. So I misread that, or misreported it to you, and that was my mistake.
No worries. Okay, that makes sense. Then turning to Dr. Richardson, you mentioned that there are that 2.4% is sort of an early rise or an indicator of an early rise that looks more like October of last year and sort of heading towards these higher numbers. Is there any indication why we're heading this way if we do have such a decent amount of the population vaccinated?
Yeah, thanks, Emily. I think, it is really important to remember that when the Delta variant came on scene, it did change things in terms of what we needed to do with vaccination coverage compared to where we were with the Alpha variant, which dominated during the preceding wave. And so, now we're saying really to have good levels of immunity in our population, we need 90% plus in terms of a full vaccination coverage with 2 doses, because of course the Delta variant does require 2 doses, not just the first dose to give us a good coverage level. So with that having happened, you'll see in other jurisdictions around the world, and unfortunately we had the experience even in May and June with Waterloo just down the road from us about what can happen when the Delta variant really gets a hold and gets into unvaccinated populations and does spread. And so that is what the concern is, and that is what we want to protect people against. And really it's quite clear there's 2 ways to protect against this virus. One is to continue to follow public health measures and to keep transmission down through masking, social distancing, all of those things. And the other is to get vaccinated. And of course, vaccination is the one that is most definitive in that way. And although there is still some risk of transmission when you are vaccinated, and that's why the masking continues to be recommended as we go forward. It is certainly your much lower risk of getting severely ill and much lower risk of transmitting it to anybody else around you. So we very, very much want to see those numbers go up.
Great. Thank you, Dr. Richardson. We'll go next to Sebastian from CBC Hamilton. Sebastian, you can go ahead.
Hi, thank you, Jasmine. Sebastian from CBC Hamilton here. I wanted to ask, a happy last day to Paul, by the way. I want to ask the group about potential 4th wave. Is Hamilton close to seeing a 4th wave? And if so, how would we know? As in, is there a number threshold, at which point we know when that would happen? And is there anything you can say about what our reaction would be? Would that impact the start of school? How would the city react?
Perhaps I'll lead us off in this one, if that's okay, folks. Just when it comes to the 4th wave, not unlike waves before us, what we're looking for are those early indicators of a rise in the number of cases, and of course in that % positivity amongst our tests that are done. And then, it's watching that to see where it goes. We know with our last wave, we had sort of these little peaklets, as my colleagues called them, as we went up. And so it did take some time for those numbers to rise, and there was some ups and downs along the way. And what we were looking for was the trends over time to see what happened. And so that's again what we're looking for, is we see this very slow level of rise happening right now. In terms of thresholds, there's not really a threshold. It is what is the continued pattern. And is it that we'll see just a slow swell that happens? Is it that we'll see something more marked in terms of the rise? And ultimately, of course, as I said earlier, that will come down to the extent to which we follow public health measures and the extent to which people are vaccinated with 2 doses. So I can't speak for the mayor and Paul, but just as we consider what will happen, I think what we need to see is what happens with the case numbers, what happens with our vaccination rates. Certainly, we're continuing to encourage people to use public health measures until we get to the point where our vaccination levels are quite high, and even then, to really stop transmission, it's really important. We know that variants only get generated when you have transmission going on. That's what causes them, is new viruses coming about as there are higher case rates. And so we really want to see those go down.
I can add to that as well, Sebastian. I mean, we've come a long way on this journey with COVID, and we have made a very, very strong point of following the science in Hamilton, very, very exclusively, quite frankly. And we're not going to stop doing that. So, you know, if the science says that we need to pull back here in Hamilton for whatever reason, because the positivity rate is higher or the case counts are moving in the wrong direction, then, you know, we're going to advocate for those steps. That may mean, you know, a tightening up of some of the restrictions that we're talking about, but nobody wants to be there. I think what we want to encourage is for people to continue to protect themselves and others, that masking is still important, and indoor, you know, physical separation still important. I was pleased to be at the Honey Badgers game the other day with the first Ontario center vaccination site fully operating. And, you know, most people were doing, you know, what they were being asked to do, which was wearing masks. It was almost exclusive, certainly in the concourse area, and unless they were eating or drinking, they were adhering to those very important kind of masking rules, which I think we want to continue to encourage people to do. As long as there's that concern out there, that's something that will continue. And I think Paul mentioned it just a little while ago, that the expectation is that masks are going to be with us for quite some time until, you know, we can, you know, safely say that it's no longer a concern for continuing spread in our community, or we have vaccinations up to a degree that we feel that herd immunity is where it needs to be. But following the science is going to be where we're going to be now and into the future. And so we'll follow whatever recommendations the medical opinions and the experts tell us are going to be needed to protect our individuals in our community and our healthcare system.
Great. As a follow-up on that, Dr. Eisenberger mentioned earlier that, sorry, Dr. Richardson, mentioned earlier that the vast majority of cases are people who are not vaccinated. What is the city doing that is different up until this point to kind of reach that final group of people who haven't been vaccinated, whether it's people who, you know, don't have access to the internet, maybe they're in shelters, maybe they're vaccine hesitant? Like what efforts are underway right now?
Thanks, Sebastian. Yeah, there's a whole lot of work that's being done by a whole lot of people around the city to make sure that people have access to the information they need in order to both understand about vaccination, understand where they're happening, and get their questions answered if they need to. So we are working with a whole collection of community agencies and getting the information out everywhere from Hamilton Centre for Civic Inclusion through business improvement associations, through numerous groups, counselors' offices. Everybody is trying to distribute information. We've got flyers and information translated into many, many different languages. Great shots I saw of one piece that was going on in one of the social housing buildings with little folders up on the wall with all the different languages with the materials translated in them so people could access them within some of these housing units. So there are lots of efforts out there to get information out. We know our primary care physicians here in our community, our practices, are calling around to their patients to ask them about their vaccination, to ask them if they need any more information. Certainly that's one of the things we've heard from folks is that, you know, often they have questions about their own particular circumstance medically that they want to discuss. And so it's really important for them to talk with their family doctor or somebody that they know that's a health professional. One of the other things they can do is remember there's nurses and doctors in every single one of our clinics, and they are more than happy to talk with you if you have any questions. If you're coming into one of our clinics or you just want to drop by, now that we're completely drop-in, you can drop in, have those questions answered, and make a decision as you go. We're also looking at really targeting our mobile clinics. So you've seen them around all of Hamilton. Initially, we were really focused on getting out to our further outlying areas to make sure that they had access to immunization. More so, they have been targeted lately to those areas of the city that have lower vaccination coverage to make sure there are opportunities right nearby for people to get vaccinated. And we're working with our teams on this work. There's family doctors and our public health nurses, as well as our vaccine ambassadors that are going to be working together to consistently stay in those areas and continue to reach out to people about vaccination. All of our healthcare partners as well, they've been looking at adopting an approach where every time they make contact with somebody that they ask them about their vaccination status, ask them if there's anything they need. And our social service agencies, community agencies have a modified tool for them to do that as well. And they can answer questions, help them to book a vaccine, make them aware of any of our clinics that are open for them to come to. And we've had some adjusted hours as well going into the evening, and we'll continue to look at it as we've got these teams out in these areas about what more do they need to do to help get the word out, and most importantly, help get needles into arms.
Great, thank you, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions. And I want to wish Paul well on his last day. We'll miss you. My first question is for Dr. Richardson. Are you confident that Hamilton can meet these vaccine thresholds that the province has set? And what is the time estimate of when we'll get there? Do you have an estimated date of when we might get to those thresholds?
Yeah, thanks, Joanna. I think absolutely Hamilton is going to get there. It is a matter of time, as you say, and that's what we've seen consistently in each of the age groups going forward. The numbers continue to rise, going up slowly. Indeed, we saw a very quick rise initially, and then it's kind of a steady rise, and now it's a slower rise for our different age groups as we go forward. So over time, we're going to get there, absolutely. We'd like us to get there more quickly, as we've talked about, and for the reasons that we've talked about. I do think it's going to be at least, a couple to 3 weeks before we get close to those thresholds that the province has set out for the full province, 80% first dose plus, no health unit below the 70%. But we really want to make sure that we are, hitting that 75% two-dose coverage across the community in every part of our community, because we don't want any part of our community to be left behind, any group to be left behind in this vaccination program. And of course, as you've heard me say earlier, we really know, as you've heard from Dr. Karen Moore as well, that 90% plus target is really where we all need to be reaching for.
Thanks so much. And my next question is also for you. Can you give us some numbers, maybe, or a bit more detail on what our current active cases look like? What is the percentage that are unvaccinated versus vaccinated? How many breakthrough infections are you seeing? And do you have any idea of what it looks like at the hospitals? Are those breakthrough infections? Are those unvaccinated? If you could give us some more detail.
Thanks, Joanna. Absolutely. No, this is a piece that people are interested in. And we did the full analysis just a little while ago in terms of the number of cases that were unvaccinated. You saw the piece from July. We're going to put together some more stats over the next few days and get those published for you in terms of what's there. Needless to say, most of our cases continue to be in those that are unvaccinated. Absolutely. But we'll put together something a little bit more precise over the next few days, and you'll be able to have access to that then.
Great, thank you, Dr. Richardson. We have a bit more time, so we will go through for one more question for everyone. We'll go first to Emily Taylor. Emily, if you'd like another question, you can go ahead.
Yeah, I'd actually just like to follow up on the question that Joanna had asked. If, assuming that this is sort of the rate that we're going to stay at for vaccinations for those second doses, at what point is there a date that we would actually reach that threshold? That's either that 70% threshold or that 75 that would push us past into step 3. Are you able to sort of give us a date?
Let me take a peek and see. One of our epidemiologists, Catherine Holtz, has been making those projections. Let me see what the most recent was, and I'll come back to you with that.
All righty, we'll go next to Sebastian. Sebastian, if you'd like another question, you can go ahead.
Sure. Question again for Dr. Richardson. I noticed that Hamilton's vaccination rates among 18 to 29-year-olds seem low, especially compared to cities like Toronto. So what are they doing that we aren't, or what is going on there that's different?
Yeah, thanks, Sebastian. We do know that our vaccination rates are lagging behind some of our major comparators and other of the big cities. One thing to remember when it comes to comparing to Hamilton, to Toronto, to Peel, to York, and to Ottawa initially as well, is that they had vaccine earlier than we did and were able to open up to their hotspot areas earlier. And of course, unfortunately, look at places like Peel, almost all of the community was in hotspot areas. And so they had broad, wide access to vaccine much earlier than Hamilton did. And you've heard me talk about how time is definitely one of the factors that works with us to increase our vaccination rates. So they've had more vaccine for longer than we had. And that 18 plus range, the vaccine was open to that 18 plus group earlier as well in all of those hotspot areas. And so they had a significant amount of time before we had 18 plus availability of vaccine to the groups. That said, we do see variability. We share across the province 2-3 times a week all of the different things that we're all doing, getting good ideas. What other things can we do that will help to get our vaccines out and get the messages out? We do know that often, there's people in our community for reasons from a social determinants perspective. They have other things that they're thinking about and wondering about, and so that's where we're going out and trying to help them to get access and get information as well as they possibly can. Some people at this stage have other things that they're doing, preparing for going back to school, going off to school for the first time, or maybe busy at other things. We do hear that from some that people don't want to feel unwell as they're heading into these final weeks of summer. They're worried that the vaccine might make them feel a bit unwell. And so very much reminding people that the side effects really are pretty mild. You may feel a little crummy for a day, but it's a lot better than getting COVID-19 and feeling crummy, not just for a day, potentially for a long period of time, especially with long COVID. And so, it is just so important, especially in those age groups, that we do get those vaccination coverage rates up. They have been the age group that have had a huge number of our cases over time and are definitely vulnerable to the virus.
Thanks, Dr. Richardson. We'll go back to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. My question is for Dr. Richardson. Dr. Moore has long been talking about this predicted surge in September of cases, but that seems to already be starting before we even go inside or before school starts. Do you have scars in forecasting to give you an idea of what we're looking at here? And what do you think about the fact that we're already seeing cases starting to rise in August?
Yeah, thanks, Joanna. This concern about when would the rise happen related to the Delta variant, as you heard me say earlier, when it came to Waterloo, they saw it very early. They saw it in May and June. They saw it in their vulnerable populations, but they saw it in their general population as well. And so we've already seen in Ontario what a surge of Delta can look like. And that's something we've all been concerned about. We've seen it in other parts of the province as well, up in Porcupine and in other areas. So, we've been concerned about it. We really want to drive those vaccination rates up. We do have additional Scarson modeling that we are going to be bringing forward to the Board of Health this week and talking about what we see there. And that's why, we're continuing to emphasize the importance of vaccination. It is our primary tool that we have to reduce the impacts of the Delta variant. And then, of course, public health measures remain a mainstay as well.
Great, thank you, Dr. Richardson. Just want to check with you if you wanted to answer Emily's question now, or did you want to get back to her later?
Jack is working on it, as am I. I'm just going to take one last peek. If you'll give me a moment, Jazz. We're going to have to get back to her. Neither of us can find them in our emails, so we will. And Catherine's actually off today, so we're trying to see if one of her colleagues has them. We'll send them on to you, Emily.
Sounds good. Okay, with that, Mr. Mayor, we are done with our media questions today, so we'll pass things back to you.
Thank you very much, Jasmine, and to Bill Custers and the entire team at Cable 14 and Clear Cable for helping us put these advisories together. And thank you to the media partners for continuing to share this very important information with the community at large. For those that want more information on COVID-19, financial supports, and any updates, visit our website at hamilton.ca/coronavirus. And please continue to follow up all public health measures and get your vaccine as soon as you can. You can find the latest information on the city's website at www.hamilton.ca/coronavirus or by following us on social media. And just to finish off, Paul, we wish you 100% well in Toronto as you wind down your work here in Hamilton. Hopefully enjoy a couple of weeks of quiet time and then get into the big smoke for some very important work, I'm sure. Thank you all for joining us today. And our next media briefing will be Monday, August the 23rd at 3 p.m. Have a great week. Enjoy the heat and the summer, and we'll talk to you soon.